Hi everyone. In this video, we're going to cover all the most important things you need to know about esketamine, also known as Spravato. We'll go over side effects, who can't take the medicine, how it works, what it's used for, dosing, how long it takes to start working, what to monitor while taking it, and some special considerations I think are important to know. My name is Mattias Hartmann. I'm a physician associate, board certified in psychiatry, and I work full-time in psychiatry. I make these videos for everyday people like yourself who want to better understand depression, depression treatments, and medications. Let's start off by going over side effects of Spravato, also known as esketamine. The most common side effect is dissociation at 28%, followed by nausea, 25%, dizziness at 22%, and headache at 19%. Some less common side effects include anxiety at 10%, low energy 7%, vomiting 7%, high blood pressure 5%, trouble sleeping 5%, throat irritation 4%, numbness and tingling 4%, vertigo, so room spinning 3%. Next, let's go over some rare but dangerous side effects. So the first one here, dissociation. We already went over that one earlier at 28%. So it's not rare, but it is potentially dangerous if you're operating machinery or if you fall. So that's why there's also a period of observation that needs to happen after someone administers Spravato at the clinic. There's about 2 hours after each treatment that people need to be watched or observed after treatment. High blood pressure can happen, about 5%. It's not super rare, but it needs to be monitored, can potentially be dangerous. The highest blood pressure is about 4 minutes after taking the medicine, but can last for about 4 hours. And cognitive impairment, again, not super rare, usually goes away within about 2 hours. So who can't take Spravato? Well, if you've had an aneurysm, if you've had a brain bleed, if you've had any kind of heart event about 6 weeks ago, usually that's like a heart attack, so a recent heart attack, or if you have an allergy to esketamine or ketamine. So how does esketamine work for depression? Well, let's start off with how esketamine was made. Esketamine is the S enantiomer of ketamine, meaning it's a part of it. It's like the mirror image part of it. So if we look at that picture down there, esketamine is part of ketamine. Ketamine has two parts, and esketamine is the left side of it, the S enantiomer. So let's go over the mechanism of esketamine. It blocks NMDA receptors, so N-methyl D-aspartate receptors. This causes glutamate to be released, so a surge of glutamate gets released, and this activates AMPA receptors. These AMPA receptors then send voltages to activate mTOR C1, and this increases BDNF, which is brain-derived neurotrophic factor, which is like the brain fertilizer that helps activate the neurons in the brain of someone who is depressed, which improves depression. So what is Spravato used for? Well, let's go over the FDA approvals first. It's approved for treatment-resistant depression in adults as an adjunct medicine. So not by itself, but in addition to another antidepressant medicine. Let's say someone's taking Lexapro and they've gotten some improvement, but not, so partial response is what that's called, but not full improvement, then Spravato might be a good treatment option there. And it's also approved for depressive symptoms in adults with major depressive disorder, with acute suicidal or suicidal thoughts or behaviors. Again, as an adjunct, which means an augmenter. It's being used to augment something, for example, Lexapro, going along with that example. And what else is it used for? Nothing that I could really find. It seems like depression is the main indication. So how is Spravato dosed for depression? Well, the starting dose is 56 milligrams twice weekly, and you want to continue your antidepressant that you've been taking because, again, this is an adjunct, meaning an augmenter to the antidepressant that you've been taking. The usual dose range is 56 to 84 milligrams per dose, and doses per week depend on the phase that you're in. If you're in week 1 through 4, usually it's twice weekly. If it's weeks 5 through 8, usually once weekly, and 9 plus, I mean, it depends. One would think it's once weekly, but really you want to use the minimum effective dose to maintain benefits. If someone has needed it twice weekly this whole time, maybe they'll just continue on it twice weekly then. The max dose is 84 milligrams twice weekly. So how long does it take for esketamine, also known as Spravato, to start working for depression? Well, that's where it gets really interesting. It actually can start working as quickly as 24 hours. So as you may know, many other medicines like Lexapro, Prozac, sertraline, many of these other antidepressants, they take about 2 to 4 weeks to start working. So that is one of the major benefits of esketamine, is that it starts working really quickly. So is there anything that needs to be monitored while you're taking Spravato? Well, really everything that needs to be monitored is going to be done by the clinic you get the Spravato intranasally at. So they're going to monitor your blood pressure. That's something you can monitor as well and bring them records of what it's been trending. And then if someone already has psychosis, you got to be cautious there, because one of the biggest side effects was it showed up to about 28% of the time was dissociation. So maybe feeling an out-of-body experience or feeling like things aren't real around you, which can be disorienting. If someone already has psychosis, they're already struggling with identifying what's real and what's not real. So you have to be extra cautious there and inform them really well beforehand so they're aware of that. And lastly, let's go over special considerations for Spravato. You have to be monitored for 2 hours after taking Spravato, so you got to incorporate that into your schedule that day. You can't drive home because of the disorientation and dizziness and just feeling unwell that it can cause for quite a while after. Really, it's recommended to rest until the next day. It works quickly. That's a plus. As quickly as 24 hours. So as quickly as a day. It is a Schedule 3 controlled substance, so something to be aware of. Something for everyone to be aware of who takes a medicine is whether it's a controlled substance or not. It is safe on the kidneys, which is nice. So if you have any kidney disease, it doesn't need to be adjusted. The dose doesn't need to be adjusted. And lastly, it works for suicidal thoughts. It has an indication there. If you enjoyed that video, you might like this video next on screen, where I go over Auvelity, which is a combination of two medicines, Wellbutrin and dextromethorphan, and its mechanism works very similarly to Spravato and ketamine. So I go over everything you need to know, all the most important things in that video. I'll see you over there.